Welcome to Courage Zone, a space for survivors, advocates, and those seeking understanding on the journey of healing from childhood sexual abuse. My name is Sergio, and I'm your host. I invite you to join me as we break the silence, share stories, and explore the path towards resilience and recovery. My podcast is a safe space where honesty, courage, and empowerment come together. Whether you're a survivor, a supporter, or someone looking to learn, you're not alone. Healing is possible, and every voice matters. So before we begin, please note that today's conversation may discuss sensitive topics. If at any point you need to pause and take care of yourself, please do so. Your well being comes first. And my podcast contains discussions about childhood sexual abuse, trauma, and recovery. These topics may be distressing and triggering for some listeners. If you are a survivor or someone is affected by these issues, please listen with care and prioritize well being. This podcast is for informational and support purposes only and does not substitute professional, medical, legal, or psychological advice. If you or someone you know is in crisis or needs support, I encourage you to reach out to a qualified therapist, counselor, or a crisis helpline in your area. By continuing to listen, you acknowledge that you understand the sensitive nature of this content and you take responsibility for your emotional safety. You are not alone. Help is available. And so now let's begin. As I've mentioned in my graduation speech, maybe I should first start off that I know it's been a few months since I've done a podcast. As I may have mentioned before, that I went away for a couple of months. I started back in October the 15th, and through December 10th, I went to a place. It's called Bellwood in Toronto, and they have various programs. I went for trauma, and it's called a TRP, which stands for Trauma Recovery Program. And I also went for a secondary program called MAP, which stands for Mood and Anxiety Program. And let me tell you, it was well worth it. An exact 57 days of it was well worth it. As I mentioned in my graduation speech, the hardest part about Bellwood was the first 42 steps. Those 42 steps was how many it takes to walk up the ramp before going inside. Once I came in, it was straight to a room where they took away my keys and cell phone, plus all my meds and anything sharp I had. The reason they take away your cell phone is because they want you to have total focus on the program and your recovery. The meds that you take on a daily basis, well, they want to administer them. And lastly, anything sharp, well, that's so you don't hurt yourself while you're inside. I also had to do a pee in a cup to make sure that I wasn't under any drugs or alcohol. They took blood sample as well. And one thing, I guess I'm ignorant to certain things, but I wasn't aware that CBD oil stayed in your blood system for 30 days. I thought, stopping to do my CBD oil to help me sleep, I stopped it about 3 or 4 days before going in. And so when I did the pee in the cup and the blood sample, he came to me and goes, do you do marijuana? I was like, no, I take CBD oil to help me sleep. Oh, okay. They went, yeah, that stays in your system for 30 days. I was like, oh, I was not aware of that. Anyways, to continue my story, the first few days were somewhat difficult. I had to deal with not having my wife beside me to give me that support I needed, but I had to deal with all my insecurities, and I didn't realize how many I had. First off, I should mention that this was the first time in 19 years that I'd been away from my wife for so long and not having her beside me. And it was extremely difficult, not just on my part. Speaking with my wife later, she found it difficult as well. And so we both realized that this can happen again. And these are some of my realizations. I had not been the husband that I should have been, that my wife was not going to leave me because my faults and my insecurities, even though I felt alone and scared and never really felt supported. That in fact I wasn't alone and I had all the support of my wife and adopted family. That I was a good looking man and that I have many great qualities. The first 2 weeks were tough, as I mentioned before, and because I didn't want to deal with all the hurt and pain I had been through in my life. But if it wasn't for my wife and my close knit support system that I had, I really don't think I would have stayed. I had initially gone because I wanted to be a better husband to my wife, but at the end, I realized I did it because I wanted peace of mind. I wanted that voice to stop screaming at me. I wanted to live a peaceful life and no longer minimize my strengths. While week 1 and 2 were intros to the sessions we were going to have, week 3 through 7 were extremely intense. I quickly learned that whatever I put into these programs, it is what I was going to get. So I put all my heart into it, and at the end, I was a better man for it. The healing couldn't have happened due to many people who helped me along the way. A female who was in the trauma and MAP program who helped me a lot. She helped me put myself back together after being broken by the therapists, and that sort of friendship will never be forgotten. My roommates, all three of them, I won't name names, who became more than a roommate once we all opened up to each other and helped each other heal. It felt good to talk to people who understood what I had been through and without judgment. At this point, I want to end that personal story here, but I will continue to tell you about Bellwood. The Trauma and Psychological Injury Program is designed to assist individuals in recovering from trauma and post-traumatic stress disorder, or otherwise known as PTSD. The 8-week program is a residential program, what they call an inpatient program. Excuse me. It provides evidence-based treatments administered by a multidisciplinary team, sorry about that, of mental health specialists, including doctors, nurses, psychiatrists, occupational therapists, and master's level therapists. I can tell you, my personal experience, I wasn't, I guess I wasn't aware what Bellwood was or is, what it did, and who are the people inside. I got to tell you, the doctors are outstanding. Nurses are fantastic as well. At one point, I had an episode. I was taking some sleeping medication because I didn't have my CBD oil. Well, I had a reaction to one of the sleeping medications. For some reason, I had a reaction. It wasn't. I don't think it was an alert. They call it an allergic reaction, but I don't think it was. But anyway, um, I felt like my heart was going to stop. I had difficulty breathing. Scared the crap out of me. And I thank God for one of my roommates coming in and asked him for help to call a nurse or a doctor. Well, they quickly came and, they took my vitals and asked me what was going on. I told them, and, I didn't remember the medication that I'd taken, the sleep medication. So one of them ran back, came back. He says, "This is what you took." So they gave me a particular medication that would offset what they had given me. So within, I don't know, 15, 20 minutes, all these other symptoms just seemed to dissipate. And boy, they were fast and they were great. Of course, you have, I didn't use a psychiatrist. I did use an occupational therapist and a therapist. And, the therapist, I told her she broke me. As a young lady who she really knows what she was doing, or she knows what she is doing. And she broke me. She broke through and she broke me. She got to the bottom of everything that I had been holding on to, all the hurt, all the pain, all the suffering. And if it wasn't for her, I'm not sure, you know, again, I had to be honest with myself as well, but she just probed, I don't know, it was the right way of probing. She really got into asking me questions and the whys and the whos and the wheres. Um, and of course, they're just fantastic. Same as the occupational therapist. She was also very good. And one of the other therapists that I call them teachers through the sessions that we were having as a group. Um, I first didn't, I guess, get off on the right foot with her, but later on, what I thought one thing, it actually was another one of my insecurities. And once I realized it, I apologized because I was being a little difficult. Well, not little, I was being difficult. Anyways, so the key features of the program of what I call TRP is therapeutic approaches. The program incorporates various therapeutic techniques, such as cognitive processing therapy, otherwise known as CPT, prolonged exposure therapy, cognitive behavior therapy, CBT, and dialectical behavioral therapy, DBT. I'm telling you, those four is what I dealt with on a day-to-day basis every single day, with the exception of Saturday and Sunday. But every day I dealt with those particular therapy programs, things. And every day was, like I said, starting week 3 right through week 7. It was very, very difficult, very intense, very scary. The next is holistic activities, which says participants engage in physical exercise, recreational activities, and mindfulness practices to promote overall well-being. Another one of those things that they, when they first approached me with all of this stuff, I was like, Jesus, horse hockey. Like one of them was art therapy, and believe it or not, like the first class I attended, oh my God, I thought, what a bunch of horse hockey this crap is. Like, who the hell's going to fall for this crap? Well, that would be me. I fell for it because shortly after starting, one of the first things the therapist said was, I want you to, however you're feeling, I want you to paint a picture. Any kind of picture, doesn't matter. Excuse me. Any kind of picture, doesn't matter. Whatever, however you're feeling, whatever you do. Let me tell you, I started painting a picture that covered a lot of things. And wow, like I said, I wasn't in believing this crap, but I fell for it, and I do believe in it. And that wasn't the first class. We had other classes as well. And wow, um, I'm a believer of this stuff. They, as I mentioned before, they also have individual and group therapy. And the program offers both individual psychotherapy sessions and group therapy to provide peer support and professionally guided emotional processing. It's outstanding. Psychoeducation, which is educational sessions, help participants understand the nature of their trauma and develop effective coping strategies. Once again, that stuff, wow. And of course, one of the greatest things is the aftercare support. So you get 1 year of aftercare, which is included in the support for long term. So basically, once you graduate, you have access. First, you become an alum to Bellwood, which means that you can go to Bellwood at any given time, listen to whether it be AA meetings, CA meetings, um, all sorts of meetings that they have there. You may think that, let's just say, for example, AA meeting doesn't pertain to someone like me who's went for trauma or mood and anxiety disorder. Well, you would be wrong, because the stories, people's stories, you tend to resonate. And I did, listening to individual stories on certain evenings, Saturdays. Part of it was on Saturday. There was various different sit down listening type of programs, you could call them. I attended quite a few of them, and they were life changing, every single one of them. I even sat down one because one of their programs is called an ED, which, stupid me, I thought it was erectile dysfunction, but it was not. It's eating disorder. And I attended to one of those, and wow, I resonated with that story as well. So, while in certain things I felt that did not pertain to me, sorry, what did not pertain to me, it actually did. And like I said, I had to put all my heart into every single session that they were offering. I sat down with an open mind and gave it a go. Now, they also offer, like I said, specialized residential treatment programs for individuals dealing with trauma, mood disorders, and anxiety disorders, which is also known as MAP, Mood and Anxiety Program. The 8-week program, residential program, is tailored for individuals of age 18 and older who are experiencing chronic depression, bipolar disorder, not in an active manic episode, or various anxiety disorders, including generalized anxiety, social anxiety, panic, and agoraphobia. And the program encompasses individual therapy sessions, small group therapy, psychoeducation, in vivo exposure therapy when appropriate, daily physical exercise and education, nutritional education. Nutritional education, wow, that was an eye opener. Yeah, recreational and social activities, family support, and psychoeducation. And the program is designed to provide a structured and supportive environment, facilitating meaningful progress towards recovery and sustained well-being. Also at Bellwood, they have multidisciplinary team includes psychotherapists, social workers, physicians, and nurses, all dedicated to providing evidence-based treatments to guide individuals towards recovery. The atmosphere. Well, it's been described in various ways by former clients, being one of them, and staff, reflecting on ranges of experiences. The supporting staff, I'm telling you, to me, in my opinion, they were great. Anytime that you were in need to talk to someone, if you're going through a difficult time or a situation, the supportive staff was there no matter what time of the day or night it was. And they were there. And so many individuals have praised the center's experience and compassionate staff, highlighting their dedication to patient recovery, which is true. I'm I'm totally agreeance with that. They were fantastic. And then you have the comprehensive care, which the facility offers evidence-based treatment approaches and supportive environment that fosters healing and recovery. Again, yeah, it's every single staff member. I had I wouldn't say a situation, but I had a particular thing that I had to deal with. Very helpful. They were supportive. They were, they did whatever it needed to do in order to, at the end of the day, for me to be happy. And so, you know, it's a good place. So if whoever's listening, if you're having issues with mental health, trauma based, dealing with anxiety, mood disorder. As I mentioned previously, this is the place to go. Now, Toronto's not the only place. So if you're looking, they have 14 different locations across the country. So in every province, I think has one. So no matter where you are, look them up. Uh, look for EHN Bellwood Toronto, or just put EHN Bellwood, and the different locations will come up. So now the other thing too is, the people who have attended Bellwood and completed its program often describe the range of experiences in their recovery journey. Their post-treatment state depends on the various factors, including the level of engagement. I told you, it's if you're all in, you're going to get everything out of it. The severity of the condition, and of course, their aftercare support. So, there's nothing but positive outcomes. Obviously, I've made good contacts, good friends, and I still keep in contact with those individuals. And everybody's still in the positive side of things. I did hear there's one or two of the individuals that actually, they fell off the wagon, so they have to go to a different recovery program. But it just, it gave me renewed hope, and it gave me stability. Um, it made me feel, more stable. I was equipped with coping strategies and hopeful about the future. And this was the very first time in a very long time. I had stronger coping skills. They gave me structured therapy and education. Um, I developed tools to manage triggers, stress, and emotional regulation. And I had a supportive community. I call it, I don't like using community, but I do see it. Why? Because you leave with a newfound sense of connection. Often, you're forming bonds with others who have shared similar experiences. And the top of it all, you end up leaving with improved mental health. Those who actively engage in the program, and I say actively because if you're all in, you will get everything out of it. When they follow through with the aftercare, often report reduced symptoms of anxiety, depression, and PTSD. I can honestly tell you, I still keep in contact, through a text message, through messages, through Facebook. I keep in contact with the most important people that helped me at Bellwood. And, we're all still helping each other, even though we're not in the same building, we're still here for each other. So, and of course, on a different note, you know, 1 week before leaving Bellwood, you're asked to come up with a schedule of activities that you're going to do. And the other is to come up with a particular schedule for food and snacks. And they ask you to come up with healthy choices. Um, and so, well, I can honestly answer, since I left Bellwood back on December 10th, that I have kept to my schedule and food as long as the weather has allowed me to, because part of my schedule is to go out walking more often than what that I had been before going in. And so, when the weather was somewhat good, I went. But if it's too frigging cold like it's been lately, unfortunately, I have not been able to do that. But food wise, I still maintain a good sense of health. I'm eating 3 meals a day. I'm eating, a lot of protein in the morning, which I wasn't before. So I'm keeping on the good side of things. I still have that positive attitude that I came out with back on December the 10th. I'm still having, that peace of mind. Um, Everything so far is working out really good. Now I can't speak for my wife, but I'm hoping that I am, I am a better husband. The other thing is I had to change my cell phone number recently, as I promised myself when I was in the inside that I no longer wanted to have any form of contact with my blood related family. As I mentioned before, I dealt with all my pain and suffering while I was in the inside, and my blood family does not provide any positive influence in my life. I had to come to the realization that I felt nothing for them, from the egg to all my so called siblings. I know that some of them listen to my podcast, but they don't seem to understand that I no longer want to hear from them, no matter how many times I've told them, and thus the reason for changing my number. Again, you tell somebody that you don't want no longer wish to hear from them for various reasons, and those are boundaries that I've set, but they continue to just like they don't care. They continue to call. They continue to leave voicemail messages. They continue to send emails. They continue to contact other people. And then so that eventually message comes back to me. And it's like, oh my God, like just stop, just stop. It's an inconvenience. I got it, it was an inconvenience changing my number because I've had that number for, I don't know, 20, 25 plus years. But I didn't care. At the end of the day, it had to do with, my peace of mind. And so my peace of mind, and that is my priority, not them, but me. And the last thing I want to leave you guys with is, of course, my egg is a narcissistic person. And one of the other things one of the many things I learned on the inside was how to silence one, how to silence a narcissist. And number one is stop engaging. So if the person is sending you emails, voicemails, whatever, you don't respond back. You just silence. Again, set firm boundaries and stick to them. Stick to them. Like I have. I stick to them. And these people, like I said, they just keep pushing and pushing, The other thing is don't defend or explain yourself. You don't owe them that. Use indifference and not anger. And lastly, walk away and limit contact or go no contact. And this is what I have done. I'm done. Before I walked away and had limited contact. Now it's like I don't want contact, period. I don't know for how many years now, 19, 20 plus years. I don't want any contact with them. I'm done. You can't change a narcissist, but you can control how much influence they have over you. The more you detach, set boundaries, and refuse to engage in their games, the quieter they become in your life. And as I wrap up today's episode, I want to emphasize the importance and awareness and education around childhood sexual abuse. I know this topic is incredibly sensitive and it affects countless lives, but together we can create a supportive environment for survivors. So if you or someone you know is struggling, please reach out for help. There are resources available, including hotlines, support groups, professional counselors who specialize in trauma. And remember, you're not alone. And there is hope for healing. Trust me, there is hope. Thank you for joining me today. Let's continue to advocate for awareness, prevention, and support, ensuring that every child can grow up in a safe and nurturing environment. If you found this episode valuable, please share it with others and help me spread awareness. So until next time, take care of yourselves and each other.